Hello, my name is Brian Oltman. I'm a licensed marriage and family therapist in San Diego, California. I have a private practice in Mission Valley, and I also work at Sharp Mesa Vista Psychiatric Hospital. You can find more out about me on my website, www.bkocounseling.com. Today, I'd like to share some information, some insight, some maybe helpful thoughts about the concept of mindfulness based treatment for anxiety. Maybe you've heard of mindfulness, but always kind of wondered what it is all about. And I know you've all heard of anxiety. So today, focusing on the thought of mindfulness based treatment for anxiety and evidence based treatment. Mindfulness based treatment. Mindfulness based therapy is based in the here and now, focusing on the individual experience of feelings, thoughts, and emotions. Being present, being in the moment, dealing with those feelings, thoughts, and emotions that we often don't want to deal with, but can be very helpful. Mindfulness-based practices have been found to benefit people with various physical, mental health issues, and emotional needs by teaching people the practices of mindful breathing, mindful yoga practices, and mindful activities. According to Dr. William R. Merchant of the George E. Wayland Veteran Affairs Medical Center and the University of Utah in Salt Lake City, he said an extensive review of therapies that include meditation as a key component, referred to as mindfulness-based practices, shows convincing evidence that such interventions are effective in the treatment of psychiatric symptoms and pain when used in combination with more conventional therapies. With 50% of successful treated cases of depression ending in relapse within 1 year, mindfulness-based therapists are using mindfulness techniques or treatments to reduce the high relapse rate, and they're finding promising results. Mindfulness-based treatment has a common thread. Mindfulness-based stress reduction has helped people to specifically address and cope with a variety of anxiety-inducing symptoms, which is the focus of this presentation. Stress reduction and anxiety-reducing practice. Mindfulness meditation is familiar to most major religions in the world, but it is also practiced by other non-religious groups. It has its base, which is found in Buddhism, as a form of meditation that's been in existence for several thousand years. It's also become a popular tool for coping with various psychological symptoms in the world of behavioral health for the last 25 to 30 years. So we're finally catching up. Research has shown that mindfulness-based practices have tremendously helped people cope with chronic pain, hypertension, heart disease, cancer, gastrointestinal disorders, as well as psychological problems such as depression, panic, and of course, our friend anxiety. Mindfulness-based treatment and anxiety. Anxiety is a very powerful force, and one in which the practice of mindfulness-based therapy or treatments helps to manage and cope. Anxiety is one of the most prevalent diagnoses and common experiences in society today. It is one that you can experience just by walking out your front door. It seems to be everywhere. We live with some level of anxiety on a daily basis as human beings. It's impossible not to react to the situations around us with some level of anxiety. Work can be stressful. Relationships can be challenging. There may be some health or financial issues, which all can trigger some level of anxiety. Now, anxiety disorders are distinguished from sort of the everyday commonplace anxiety in that they involve anxiety that, number one, is more intense, for example, panic attacks. And if you've ever had a panic attack, you'll know what I'm talking about. Two, lasts longer. Anxiety that may persist for months instead of going away after a stressful situation has passed. And three, leads to phobias that interfere with one's life. How does mindfulness-based therapy help cope with what is seen to be everyday anxiety, the front door anxiety, and then also the anxiety disorders, that persisting anxiety? One of the first tenets of mindfulness-based therapy is the acceptance of the feeling as valid, and that experiencing the feeling is important, even though it may be uncomfortable. Sometimes we just don't like those feelings that we're having, and they're uncomfortable, so we don't want to feel them. Mindfulness-based treatment is an acceptance of the feeling in the here and now, in the moment, as we talked about earlier, and not judging the feeling or judging ourselves for experiencing it. Mindfulness-based practice often begins with an exercise of centering, focusing on one's breathing or positive thought, which can be a mantra of some sort. Mindfulness allows for distraction, and I'm thankful for that because I can become easily distracted. And it seems to use this distraction as a way to learn to be tolerant of self, others, and the world in which we live. This may be a challenging process, which may mean an individual's core beliefs, those beliefs that we hold deep inside, may come forward as we start to experience feelings and emotions in new ways. If one's core belief is that feelings such as anxiety or panic should not be experienced at all costs, for any reason at all, hearing about a non-judgmental approach to accepting one's feelings would be very challenging, to say the least. Mindfulness-based therapies not only increase one's awareness of the relationship between thoughts and feelings, but seem to be intended to rearrange the dynamic of how people relate to their thoughts and feelings in new ways. It's about seeing things in new and different ways. That internal dialogue somehow changes. Treatments are designed to help clients change how they relate to their thoughts and that internal dialogue, as I just mentioned, that negative self-talk. If the inner dialogue is being rearranged, and seen differently in more positive light, and then one views oneself differently based on mindfulness-based practices, then the outer experience also changes. If the inner changes or sees things or gets rearranged and views things differently, then the outer experience also changes. The anxiety level lowers. An individual is no longer stuck with the expectation that what they say or do is wrong, or they have to be perfect in order to be of value. Any mistakes made would then be seen as an effort made. We say that again. Any mistakes made would then be seen as an effort made rather than something which would not have been even tried before. Mindfulness-based therapy takes practice, practice, practice. And maybe you didn't want to hear that. Maybe it sounded like something from your childhood. The core of this theory seems to be about incorporating this type of practice into the essence of the human experience. Mindfulness-based therapy is intentionally practiced in ways which other therapeutic models, techniques may not overtly exhibit, may not overtly be seen. The intentional breathing in and out, finding a mantra, a peaceful place inside, the rearranging of the inner dialogue, all of that is very intentional. There is an opportunity to center into oneself when the anxious moment arises. Centering into self, seeking a calming presence, focusing on each and every breath, finding a peaceful word or phrase or place inside can be very cathartic and therapeutic. Being mindful of one's environment, of one's activities, and experiencing of one's feelings and emotions in a non-judgmental manner can release the power or the perception of the power that anxiety is somehow in charge and change it into that I'm in charge. I'm in charge of my feelings. I'm in charge of what I do with them. It's about taking control of one's feelings and emotions, including anxiety, and living in very intentional and very mindful ways, accepting oneself and the feelings one is feeling. Thanks, and I hope you have a great day.